What if the U.S. healthcare system were a high-stakes game, with corporate giants calling all the shots and patients caught in the middle? It's a game where spending more doesn't mean getting better results. Yet, we're pouring nearly $5 trillion into it every year. The question is, where's all that money going? And why are we still falling behind on basic healthcare outcomes? From insurance companies denying claims to pharmaceutical giants inflating drug prices, the system seems rigged to put profits before people. Let's peel back the layers and take a hard look at how we got here and whether there's any hope for change. December the 4th of 2024, early morning in Midtown Manhattan, Brian Thompson, the CEO of United Healthcare, is assassinated. Inscribed on the bullets that killed him are the words, "Deny, depose, defend," a chilling nod to the profit-driven tactics of health insurance companies. But what came next wasn't the reaction you'd expect. Sympathy for the victim was in short supply. Instead, the nation erupted into a fiery debate about the state of U.S. healthcare, a system so broken that even its critics seem resigned to its dysfunction. Here's a hard truth. Americans spend nearly $5 trillion every year on healthcare, 18% of the entire economy. That's more than any other country by far. And yet the results? Embarrassing. Life expectancy in the U.S. is 3 years shorter than in peer nations, and Americans visit doctors half as often. So, where does all this money go? Why does the world's most expensive healthcare system deliver such abysmal outcomes? To understand, we need to dissect the big players in this system: insurance companies, healthcare providers, and pharmaceutical giants. Let's start with insurance, the gatekeepers of care. 92% of Americans have some form of health insurance, whether through employers, government programs, or individual plans. Unlike in many other countries, Americans can choose from a variety of providers, offering a sense of freedom and flexibility, but this so-called choice comes at a steep price. Each insurance company has its own rules, networks, billing codes, and approval processes. Hospitals end up drowning in paperwork. In fact, 40% of hospital expenses are tied to administrative functions, scheduling, billing, and insurance negotiations, and not actual care. Administrative bloat is a major driver of U.S. healthcare costs, with bureaucratic inefficiencies accounting for 30% of the excess. But the real tragedy lies in patient outcomes. Insurers deny an average of 16% of claims, with some, like United Healthcare, rejecting up to 32%. This forces patients into impossible choices: paying astronomical bills or foregoing care altogether. Medical debt contributes to 67% of U.S. bankruptcies, while others delay treatment, sometimes at the cost of their lives. Why so many denials? Insurers claim it's about controlling costs, yet denials for commercial plans rose 20% in a year, while Medicare Advantage claims jumped 56%. Appeals, though, rare due to their complexity, succeed 75% of the time. Prior authorizations are another hurdle, often delaying urgent care. Shockingly, only 15% of doctors making these decisions specialize in the relevant field, leaving patients' fates in the hands of unqualified reviewers. It's a system designed to deny, not to care. But the dysfunction doesn't end there. Let's talk about market concentration. In 73% of commercial markets, 71% of Medicare Advantage markets, and a staggering 90% of ACA markets, a few big players dominate. Fewer competitors should theoretically mean streamlined processes and lower cost, right? Wrong. Research consistently shows that when insurers merge, premiums rise. Companies don't pass on savings to patients. They pocket the profit. The barriers to new competition are sky high. Regulations, anti-competitive practices, and massive startup costs ensure that the same giants continue to control the market. To make matters worse, insurance companies have started vertically integrating. United Healthcare, for instance, employs over 10,000 doctors directly and partners with 80,000 more. While this might seem efficient, it concentrates even more power in the hands of a few corporations, allowing them to drive up costs further while making it harder for patients to access unbiased care. U.S. healthcare has long been a topic of heated debate, and it's easy to see why. Health insurance companies get their share of the blame, but they're not the only players in this costly game. Healthcare providers are just as complicit. Let's pull back the curtain to examine how doctors, hospitals, and the pharmaceutical industry contribute to the chaos that is U.S. healthcare. Believe it or not, doctors in the U.S. play a significant role in inflating healthcare costs. Sounds counterintuitive, right? But the numbers speak for themselves. U.S. doctors are among the highest paid in the world, largely due to a doctor shortage. With only 2.6 practicing physicians per 1,000 people, well below the OECD average of 3.7, the U.S. faces a supply bottleneck. This shortage didn't happen by accident. Around 20 years ago, the American Medical Association lobbied to slash the number of medical schools, cap federal funding for residencies, and reduce residency positions by 25%. Their fear? An oversupply of physicians. The result was a a stagnation in medical school graduates between 1980 and 2005, despite a 30% increase in the U.S. population. This self-imposed regulatory chokehold is still being felt today. Hospital consolidation has surged over the past 2 decades, with 1,000 mergers among the U.S.'s 5,000 hospitals, giving larger hospitals the power to dictate prices. Private equity firms, often acquiring hospitals and physician practices, focus on maximizing profits, which leads to price hikes. Research shows that in markets where private equity controls over 30%, patient costs rise significantly, with prices for specialties like gastroenterology, OBGYN, and dermatology increasing by up to 18%. For instance, U.S. anesthesia partners in Denver charge 30 to 40% higher rates than competitors. This market dominance strains both patient finances and care quality, as private equity-owned hospitals often see higher complication and mortality rates. Even nonprofit hospitals aren't immune, with examples like UPMC's former CEO earning nearly $13 million in a year. Additionally, the U.S. spends over $600 billion annually on pharmaceuticals, far outpacing other countries, but often paying inflated prices for the same medication. Take Gleevec, a chronic myeloid leukemia drug. In the U.S., it costs $90,000 more annually than the global average. Even generic drugs aren't immune. Prices can vary wildly within the U.S. For example, a prostate cancer medication might cost $815 in northern Michigan, but jump to $3,400 near Lake Michigan. This inconsistency is baffling, especially for life-saving treatments. The healthcare system is fundamentally broken, prioritizing financial gain over human well-being. Greed, disguised as innovation and efficiency, has eroded trust and outcomes. While the U.S. continues to spend more than any other nation, it lags behind in life expectancy, infant mortality, and chronic disease management. Is there hope for reform? Possibly, but it requires a collective acknowledgement that medicine is not just another commodity. It's not a luxury car or gourmet meal. It's a matter of life and death. Even those who staunchly oppose government-run healthcare must concede that the current model is unsustainable. As long as profits overshadow patients, the system will remain a behemoth, expensive, inefficient, and unjust. So, what's the solution to all this chaos? Is this the future we want? Or can we, as a society, demand something better? Because at the end of the day, healthcare isn't just about economics. It's about ethics, humanity, and the basic dignity every person deserves. The answer might not be simple, but one thing's for sure: change is needed, big time. If you're as fired up about the state of U.S. healthcare as we are, hit that like button, subscribe, and ring the bell so you never miss a deep dive into the issues that matter. Got thoughts? Drop them in the comments. We'd love to hear your take on what it'll take to turn this ship around. Until next time, stay informed and keep watching.